In the next few minutes, we are going to explore the unmet needs in type 2 diabetes and islet enhancement with vildagliptin. Diabetes, being a global problem, has been expected to grow with a much faster pace over the years. Despite having a much lower population than India and China, Pakistan has a much higher prevalence to diabetes. By 2030, nearly 45 million diabetic cases are expected to be reported in Pakistan. Before we go into the management of diabetes, let's overview the treatment goals of diabetic patients based on the international guidelines of ADA, American Diabetes Association, ACE, American Association of Clinical Endocrinologists, and IDF, the International Diabetes Federation. For HbA1c, the level should be less than 7.0 according to ADA and equal to or less than 6.5 as per ACE and IDF guidelines. Prepandial capillary plasma glucose levels must be maintained between 70 to 130 according to ADA and less than 110 as per the guidance of ACE and IDF. And the peak postprandial capillary plasma glucose level as per ADA must be less than 180, less than 140 as per ACE and less than 145 according to IDF. In order to understand the concept of islet enhancement, let's first review the pathophysiology of type 2 diabetes. Beta cell function continues to decline regardless of intervention in T2DM. Data from the UK Prospective Diabetes Study indicates that beta cell function declines over time regardless of T2DM therapy. The specific therapies carry certain advantages or disadvantages. This data shows that the loss of beta cell function continues regardless of the intervention by sulfonylureas, metformin, and dietary control. As a consequence of islet dysfunction, hyperglycemia occurs. The islet produces fewer beta cells that leads to insufficient release of insulin, which results in a low uptake of glucose into cells. At the same time, the islet dysfunction leads to alpha cell hypertrophy and increases release of glucagon and enhanced hepatic glucose production. As a result of these two parallel processes, the blood glucose level rises. In consequence of insulin's insufficient production and elevated glucagon, the insulin-glucagon ratio gets disturbed. In a normal individual, the levels of glucose, insulin, and glucagon can be described by this graph. While insulin level rises, coupled with the fall in glucagon level to maintain glycemic control within the normal range. In a patient with a disturbed ratio of insulin-glucagon, the secretion of insulin is inappropriate, while the required decrease in glucagon level does not occur, leading to rise in the glycemic level and type 2 diabetes mellitus. As the patient enters from a pre-diabetic to diabetic stage, the islet cell function keeps on decreasing while there is a continuous increase in insulin resistance, which is due to the deterioration of islet cell function. Considering the conventional treatment option, there are certain limitations which are to be considered. As it can be seen that there is a considerable weight gain with sulfonylureas, TZDs and meglitinides. Metformin in combination with sulfonylureas and TZDs also cause some weight gain. Hypoglycemia is the most threatening condition that occurs with the use of oral antidiabetics. Sulfonylureas are the leading class that causes hypoglycemia. The results from DREAM, Diabetes Reduction Assessment with Ramipril and rosiglitazone medication, and PROACTIVE, Prospective Pioglitazone clinical trial in macrovascular events have shown evidence for thiazolidine are associated with congestive heart failure. In addition to the chances of adverse events, the conventional treatment options do not address the islet cell dysfunction. Islet enhancer vildagliptin and DPP-4 inhibition. With the normal function, the GLP and GIP levels are controlled by DPP-4 enzyme and 80% of them have been converted into inactive form by this enzyme. With vildagliptin, DPP-4 is inhibited. That leads to enhanced beta cell sensitivity to release insulin, while the glucagon release is reduced from the alpha cell due to enhanced sensitivity of alpha cell to glucose. The combined effect of beta cell and alpha cell sensitivity leads to the islet enhancer action. Patients with type 2 diabetes mellitus have an imbalance in their insulin-glucagon ratio, which is largely responsible for hyperglycemia. By inhibiting dipeptidyl peptidase 4 and prolonging incretin activity, this imbalance can be corrected and glycemic control improved, as shown by the schematic on this slide. Vildagliptin increases the levels of both GIP and GLP-1. Let's see the effect of vildagliptin on GIP levels first, as it can be seen that after 28 days of vildagliptin usage, the GIP levels considerably increase as compared to day 1. The GLP-1 levels have the same effect after 28 days of vildagliptin usage. The GLP levels considerably increase in contrast to day 1. Vildagliptin enhances islet cell function by increasing insulin and decreasing glucagon secretion. Dose-response relationships to single oral doses of vildagliptin were assessed in this randomized, open-label, placebo-controlled crossover study in 16 patients with type 2 diabetes mellitus using the oral glucose tolerance test. This study demonstrates that vildagliptin enhances islet cell function by increasing insulin secretion and decreasing glucagon secretion, thus reducing glucose levels. Vildagliptin inhibits DPP-4, resulting in increase in fasting and postprandial GLP-1 and GIP level, enhanced islet function, increases sensitivity of glucagon secretion to glucose, increases sensitivity of insulin secretion to glucose, increases first phase insulin secretion, increases capacity to secrete insulin, decreases postprandial triglycerides, decreases insulin resistance. No effect on gastric emptying. A potent, highly selective and reversible DPP-4 inhibitor, robust efficacy, sustained efficacy over 2 years. Efficacy comparable with TZD and acarbose in monotherapy at 24 weeks. Efficacy demonstrated in IGT population. Excellent tolerability. Low risk for hypoglycemia. Superior GI tolerability versus metformin. No weight gain overall. Weight loss relative to TZD. Incidence of edema similar to placebo. Overall incidence of adverse events comparable with placebo. No drug-drug interaction with commonly prescribed agents. Vildagliptin add-on to metformin. Reduction in HbA1c over 24 weeks. The results demonstrate that vildagliptin produces clinically meaningful dose-related decrease in HbA1c levels over 24 weeks as add-on therapy in patients with type 2 diabetes mellitus inadequately controlled by metformin. Vildagliptin add-on to metformin, reduction in FPG over 24 weeks. Significant dose-related decreases in FPG were observed in patients receiving vildagliptin compared with those receiving placebo. The between-treatment difference in the adjusted mean changes from baseline at week 24 was -0.8 millimole per liter for the 50 mg once daily group and -1.7 millimole per liter for the 50 mg twice daily group. Vildagliptin enhances beta cell function and improves PPG, with metformin alone is not sufficient. There were significant but similar differences for vildagliptin 50 mg once daily or twice daily respectively versus placebo. Postprandial glucose levels were also significantly lower in both vildagliptin groups compared with placebo. Vildagliptin provides clinically meaningful dose-related decreases in PPG and improves beta cell function as add-on therapy in patients with type 2 diabetes mellitus inadequately controlled on metformin. Vildagliptin effective across hyperglycemia spectrum. Pooled analysis in add-on to metformin. Data from 2 trials of vildagliptin as add-on to metformin treatment were pooled to assess the effect of vildagliptin 50 mg twice daily on HbA1c. changes from baseline in HbA1c at 24 weeks for 4 patient groups were analyzed. Significant changes from baseline of -0.6%, -0.9%, -1.1% and -1.6% were observed for HbA1c. This data demonstrates that vildagliptin is an effective glucose-lowering agent as add-on to metformin, offering glycemic control across a wide spectrum of patients with hyperglycemia. This scientific video is presented to you by the manufacturers of Galvecta Plus and Galvecta. Pharmevo, our dream, a healthier society.